Hi, and welcome to this week's episode of Ask Dr. Jessica. I'm super excited for this week's phenomenal, fantastic guest, who's also my good friend, Dr. Katie Marks-Cogan.
Hi, everybody. Hi, Jess.
Hi, Katie. Katie and I go way back. Actually, when I say way back, I would tell, when did you come into Ready Set Food?
2017.
2017. All right. So let's talk about how we got to meet each other. So do you want to explain it? Do you want to go ahead and say
Sure.
how we met?
Sure, absolutely. So I think first I met Marissa. I met one of your sisters, and we became friends. And then she is married to a very smart gentleman named Andy. And actually, Andy's been friends with my husband since college. And Andy's son, unfortunately, was diagnosed with multiple food allergies when he was about 7 months old. And so Andy had known about all of the studies about food allergy prevention and thought of an idea to create a product that could make it easy and safe for parents to introduce allergens into their baby's diet. And we all got together and came up with Ready Set Food, which we'll talk about more later. And now we're just like a big family. So your brother-in-law Daniel is the CEO, and Andy's one of the co-founders, and they're married to your sisters. And you went to college with my husband, and so it's just a big family.
Go Bruins at UCLA, if there's any
right?
Bruins out
That's
there.
right.
Yes.
And now we're all good friends.
Yes. No, so from my side of it, I have two sisters and they have two husbands, and the husbands got together and they came up with this allergy prevention product, and they really needed an allergist on board with them to be part of the team, which fortunately was you. So this is how we know each other. My two sisters, two husbands, so my brothers-in-law and Katie together have a allergy prevention product called Ready Set Food, which was on Shark Tank 2 years ago. So it's been really fun to watch the evolution of this product to help prevent childhood allergies. So, all right, so let's get into it. Speaking of childhood allergies, can you tell me about childhood allergies? Like how prevalent are they? Everybody seems to know someone now that has an allergy to something. How common are they?
Sure. So great question. So it depends what we're talking about, right? So if we're talking about food allergies in particular, about 8% of children have a food allergy, and the prevalence is rising. And for example, with peanut allergy, the prevalence has actually tripled in the last few decades.
Wow.
So if we're talking about environmental allergies, the prevalence is rising as well. And so there's a lot of different scientific ideas behind why we're seeing this rise in prevalence of allergies in general.
What do you think it is? What is your leading contending idea?
Well, okay, good question. So I think it's a combination. I think genetics play a role, but it doesn't play as big of a role as people think. So there's something called the hygiene hypothesis, which is the idea that we're kind of too clean, right? So our society's become much more clean than we used to be. We used to sort of grow up on farms around farm animals and playing in the dirt every day. And now we're all using hand sanitizer even more, unfortunately, these days. And so the idea is that we're not exposed to the right bacteria, right? The right germs early on in life when our immune system is sort of learning, right? It's learning if it should tolerate certain things, or if it should fight off certain things, or become allergic to certain things. And so if we're introduced to some of those things later in life, then the immune system gets skewed towards allergy. And so there are multiple observational studies to support this, with regard to kids growing up on farms having less decreased development of asthma and allergies. So, and the same idea for food allergies. There's vitamin D that plays a role. And
that's interesting.
Oh, yeah. So vitamin D actually has a role in the immune system, right? And so vitamin D deficiency, I think, is much more widespread than it used to be because we are indoors a lot more.
Playing those video games, right?
Exactly.
On
So,
Netflix.
are rarely outside. And that definitely has an effect. We don't know exactly the role of vitamin D and sort of how much we need, but we know too little is bad, and we think too much is bad also. And so
Interesting.
again,
So it's not just, so there's more reason for kids to get outside and run in the dirt. It's more than just exposure to allergens outdoors. It's also vitamin D really comes from the sun mainly. So that's something I never really thought about, the multiple benefits.
absolutely, for being outside. I mean, of course, we have to worry about sunscreen, or we have to worry about skin cancer, so we have to wear sunscreen. But yes, I mean, kids and adults should get a little bit of sunlight basically every day, but at least weekly, thinking about going outside. Have your kids gone outside? If not, get them out there. I think about how I used to like go in the backyard and make mud pies, and
Me too.
right. We all
Definitely.
it was probably disgusting. I'm
Sticks
sure
and mud.
some things that we shouldn't have, but it's for the better. And so those are some of the ideas. I think with food allergy, there's diet diversity, right?
Okay.
So just eating a lot of different things early on. The studies are showing that can be helpful in preventing food allergies. And then sticking also on food allergies, there's food allergy avoidance. That is a huge risk factor for food allergy, and that's why we think one of the reasons we're seeing an increase in prevalence, because we used to tell all our parents to avoid feeding allergens
Right.
to our kids early on, right? So allergens like peanuts, eggs, milk, tree nuts, foods like that, we used to say, oh, don't introduce those until they're 2 or 3.
Right.
But now we know, because we've had landmark clinical trials in the last few years that tell us that getting those foods into baby early on can actually prevent food allergy.
And I think this makes psychological sense because as a parent, if you hear that peanut allergies are on the rise, I think the natural instinct is to want to avoid peanuts altogether, thinking that will prevent your child from getting allergies. But it's actually the opposite that's true, right? The more we're around peanuts, the more likely we are to, from an early age, the more likely we can help our child prevent these allergies.
Absolutely. And I totally hear you. I think, unfortunately, food allergy has brought with it sort of a negative bias, and parents become very anxious when they think about introducing food allergens into baby's diet. Yes. And in fact, infancy is the safest time to be doing it. We have multiple studies showing us that if baby is going to have a reaction to a food early on, it's generally going to be mild. And that's the best time to sort of mold the immune system and have it go towards tolerance, like oral tolerance. But the gut has to see the food, so the baby has to be eating the food. If we're just around peanuts, if they're just sort of in our environment, it could actually be somewhat harmful if we have eczema. So eczema is the biggest risk factor for food allergy. And when I say eczema, I actually mean atopic dermatitis, which is when the skin becomes dry and red and itchy and bumpy, right? And so babies get it and all the little folds, and they can get on their face.
Right.
Adults have atopic dermatitis as well. But when babies have it and they're exposed to foods in their environment, the foods can actually get in through their skin because their skin cells are sort of leaky, right? They're not tight. And it can cause inflammation and can also sensitize them.
And explain what you mean by sensitize.
Sure, good question. So when the immune cells that hang out in our skin see these allergens, they talk to their friends and they say, hey, I think we should make some allergy antibodies to these foods. And when I mean foods, I mean like proteins in foods. Okay, so that's what our immune system is responding to, proteins in foods. So we'll just talk about peanut, for example. So the immune cells see peanut, they tell their friends to make allergy antibodies, and they go and do that. And then the next time that the baby is exposed, maybe they make more. And if the baby isn't eating the food at the same time, and all the immune cells in the gut, we have, our immune cells are everywhere, and they also line our gut. And so if those immune cells aren't seeing those same proteins in like large amounts, then everything gets skewed towards allergy, and all those allergy antibodies bind to cells. And then when the baby eats peanut later in life, they can have a reaction, and those cells can release chemicals and cause a life-threatening reaction, which we can get into. But, you know, the whole idea is oral tolerance, letting the gut immune system see the food. Even if you're seeing it through the skin, if your gut's seeing it, it can be actually helpful and preventative.
So just to sum up what you're saying, let's say there's a baby that lives in the house where there's peanut butter in the environment. That's not enough, because if the peanut butter touches the skin, that may actually make the body make an immune response that is not favorable to peanuts. But the way to make the body more tolerant or accepting or less likely to get allergies is to first expose the body through the gut by eating it. Is that right?
Perfect. That was very well said. Yes, eat it, but you have to eat it early.
You have to eat it early.
You have to eat it early.
Before the body gets a chance to think of it as an enemy or something it doesn't like by getting exposed through the skin.
Exactly.
Okay. And now I want to bring back something that you said a little bit ago, because I think it's a really important point. And that is, when babies are exposed to allergens early, you said their reaction's more likely to be mild, correct?
Yes.
Okay, yes. I want to touch on this a little more, because parents are so scared to give peanuts and other allergens early because they're afraid of a really strong reaction. So do you have any numbers or figures to explain how likely a child is to have a mild reaction from a young age?
Sure. So we have some of the landmark trials that were done on early allergen introduction. So what does that mean? So back in 2015, the most famous clinical study called the LEAP trial, which you know about, right? It's the one that sort of made Bamba famous.
It's Bamba. Tell me what Bamba is.
Bamba are those peanut puffs that now I think everybody has their own version of. Like Trader Joe's has its own peanut puffs, and you can find them everywhere. But Bamba is the OG, and it's peanut puffs are actually made in Israel, and they were used in a study to show that feeding peanut early on in infancy, starting at 4 months of age, can prevent up to 80% of food allergies. And this was in high-risk kiddos, like kids with eczema or egg allergy already. So we know that from that study, other studies have been done that also show similar results. And during these studies, they looked at the reactions, so they told these parents, give your kids peanut puffs, at 4 months of age, and keep feeding them. Oh, that's another important point. You can't just give it once. You have to keep giving it, right? You have to sustain exposure, because giving it once is not enough.
Not enough. The trial showed 3 times a week, correct? Was enough to sustain.
Exactly. So, and we can get into whether how much you really need to do on a weekly basis, because you have to be realistic. Right. But yes, that's what the LEAP study showed. And so what it also showed, and what some of the other studies showed, is that there were no severe reactions in any of the infants who were introduced to allergens early on.
So when you say severe, does that mean anaphylaxis, the fear complication? No anaphylaxis seen. Interesting.
Exactly. And no severe anaphylaxis. So anaphylaxis has, the definition of anaphylaxis, which is when you have sort of systemic symptoms, like you have symptoms in all different parts of your body and not just locally when you eat a food that you're allergic to.
So by example, can you give an example of a mild reaction? Would that be like a rash?
Absolutely. Yes, a rash. So a mild reaction, oftentimes we'll see some hives, they're kind of like red, itchy bumps that sort of sometimes look like mosquito bites. You can see hives, you can see swelling, like some people get like swelling of their lips or swelling of their eyes. That's called angioedema. And it's basically very similar to a hive. It's just like a deep version of a hive. So having, some mild symptoms like that, you would probably potentially take an antihistamine like Zyrtec or a children's Zyrtec. or just watch the symptoms and see if they self-resolve. And then more moderate symptoms can include vomiting, abdominal pain, coughing. And then obviously when we get into more severe symptoms like trouble breathing, lightheadedness, multiple episodes of vomiting, swelling in your mouth or your throat or things like that, then, we're in severe anaphylaxis territory. And the only treatment for that is epinephrine or injectable EpiPen.
Yes.
Yes. So,
I usually tell families anything that involves the airway or breathing is an emergency and should be directed to the emergency room if they don't have an EpiPen.
yeah, it's true. I think the other good thing to tell them is, especially in young children, it's hard, as you know, to tell if they're having breathing difficulty.
Right.
And so with babies, for instance, so with infants, the most likely things you will see with a food allergic reaction are hives and or vomiting. Okay, so those are the most likely things. It's actually rare to see breathing difficulty in infants, and that's why we say infancy is the safest time, because generally it's a mild reaction. As they do get older, I tell parents to really pay attention to their mood. If they become really inconsolable and they have hives all over their body, or if they become lethargic, right? And they have hives all over their body, or they have an episode of vomiting. These are also worrisome signs. And, never be afraid to use Epi. That's like, I try to empower parents. Like I say, we can do everything that I teach them to try to prevent allergies, but sometimes we can't. Sometimes we can't prevent them. And if I give a diagnosis of a food allergy or an allergy in general, I want to provide parents with tools and knowledge so that it's not anxiety provoking, right? So they can live a somewhat more normal life and have a good quality of life and just have the knowledge and feel safe. Right. So
I think it's a great point. I've actually been with my sister who you mentioned earlier, their child or my nephew who has severe multiple food allergies. I've been with her before where her son started to wheeze and she's felt nervous about his progress. He was exposed to a food he shouldn't have been exposed to. And she felt empowered actually when she made the decision to give him epinephrine at home. She was nervous, but then when she gave it to him and saw that his symptoms resolved, he was like himself, acting better, I think it actually provided her relief that she knew she could do it and did it when she needed to. So I agree with that point. I think a lot of parents are hesitant, but it's an important point to remember that it's there for you when you need it.
Absolutely. And, parents say, well, I've never had to use it, when I see older kids that maybe have food allergies. And I say, great, you're never supposed to that's great. Let's continue on and hope that you never have to use it, but you always have to have it with you. And you shouldn't be afraid to use it. It's just epinephrine, which is adrenaline, right? For a lot of people don't know that they're really the same thing. And it's really not harmful. So if I always tell my parents, if you don't know if you should use it and you're debating it, just use it. You probably feel the needle. It's really not that scary. They're not going to have any major side effects. Maybe their heart's going to race a little faster, things like that. But it's actually quite safe. And so you can't be like wronged for using it if you think you should use it. Just do it.
Right. Okay. So this is all good news, what you're saying. So just to sum up, you're saying that when babies try food allergens or foods that may potentially cause an allergy, most commonly, it's going to be mild and they will not need any intervention. It will resolve on its own. But if they're that small percent of kids that have allergies that do have an overreaction, there's a treatment for it.
Yes, exactly.
Okay. And I have so many families that are so nervous about food allergies. They ask me if they can try new foods in my office, or I've actually had some families admit to me that they go to my parking lot in my office, which makes me a little nervous, but they're in the parking lot trying, nuts for the first time. Do you think that people have to do this, or can they is there a time they need to see a medical doctor for the first time that they're trying a food, like maybe there's food allergies in their family, or do you think it can be safely tried at home?
Such good questions, and very important. As we already mentioned, we know that food allergies and food allergens are very scary to parents, and I have the same experience where a lot of people do want to introduce in my office or in my parking lot. I was in a mommy and me group when I had my son, my first child. And, there was one day where one of the moms brought in a bag of Bamba because all the moms wanted to introduce while I was there. And so I was like, well, okay, 10 babies are eating Bamba right now for the first time, which was fine. I wasn't nervous because infants are generally fine. But yes, it just goes to that idea that it is anxiety provoking for parents. And so you asked if there's a time where families should seek out, their pediatrician or, ask their pediatrician to be referred to an allergist. And what I say to that is, some babies that have severe eczema or severe atopic dermatitis should be, either they should have a discussion with the pediatrician about introducing allergens and if any screening is necessary, or be referred to, be referred to an allergist to discuss that. If food allergies run in the family, generally speaking, there's no need to see an allergist. There's no need to be screened. We don't screen anymore because we have so much data now telling us that we don't need to screen siblings. I mentioned that genetics plays a role in food allergy, but we know that if a child has a sibling with a food allergy, that child's risk of then having a food allergy is only slightly higher than the general population. It's not as high as we used to think. And so it's actually better.
Do you know what it is? Not to put you on the spot, but
about 13%.
Okay, so if there's 8% allergies, food allergies in the general population, if a sibling has an allergy, the risk goes up to 13%. Okay.
Exactly. And so thinking about eczema, just to give you something to compare to, if a child has severe eczema, their risk is about 30% that they will develop a food allergy. So that's why eczema is so important. So if your child has, your infant or your, toddler has a rash, an itchy red rash, definitely talk to the pediatrician about it and, see what you need to do. And the earlier, the better, right? So for these kiddos, it's even more important that at 4 months of age, they really start introducing food allergens.
Now, do you think the severe, so I know so many kids have eczema. I think the numbers I've read, somewhere between 20, even 25% of kids have some even mild eczema. So it's so prevalent. Obviously all those kids, we don't want them seeing allergists or the pediatrician to safely be with us to introduce foods. So when you say severe eczema, is that just more widespread on the body? Can you paint a picture for families what that would look like?
Good question. Yes. And it is hard to know, I think, as a parent, especially if you haven't had experience with it, to know what is mild, moderate, and severe.
Right.
So you're right. So the way I talk about it is if it is very diffuse or widespread on the body, right, multiple, areas, a lot of surface area of the body is covered, or it doesn't always have to be all over the body. It could be just in certain areas, and then just be really, really hard to manage, right? It could be get infected easily. It could, the baby could scratch it and it could bleed a lot.
Right.
Right. The baby could have trouble sleeping at night because they scratch all during the night.
Right.
So it doesn't have to be all over your body. But a little, eczema, little mild eczema, you don't, have to wait to introduce foods. You should actually not wait, right? Any eczema at all, don't wait. Get it in early.
I love hearing you make this point because it comes up so much. So a little eczema, do not wait to introduce foods.
Do not wait. Do it. And, just you can read about it. Hopefully you're learning here, whoever's listening, we want, knowledge is power, right? So feel confident. If your baby has eczema, unless it's severe, like we talked about, start introducing foods really early on, starting at least at 4 months of age. And if you think it's severe or you're not sure, then seek out your pediatrician. And hopefully that can be done quickly so that a decision can be made if they need to wait or not wait or get screened, like I mentioned, and see an allergist.
One subtle question or one subtle point I'd like to make. I have some families where the child has eczema. They introduce milk, let's say, and they see the eczema get worse when they're having that milk product. And the instinct is to change formulas. Do you think in that situation, to a non-milk based formula, do you think in that situation they should power through and continue to feed with that milk-based formula, even if it makes the rash slightly worse? Or do you, because I feel like a lot of people see a reaction, they want to pull away from it, but if continued exposure helps prevent the allergy, what are your thoughts on that?
Yeah, it's a little counterintuitive, and this is something that I spend a lot of my days talking about.
Me too.
I know, we're the same.
We got that in common.
That's great. So basically what I say to parents is eczema is a skin disorder, and it will flare sometimes without rhyme or reason. The number one cause of eczema to flare is actually rubbing or scratching, right? So once you scratch and rub,
we call it the itch that rashes.
Exactly, right? So it's a cycle.
Once you itch, it rashes, yes.
Scratch cycle, right?
Yes.
It itches, you scratch, it gets worse, it gets worse, it gets worse. Also rubbing, right? So that's why it occurs in the folds. Like a lot of people don't realize that, because that's where the skin rubs together, right?
Yes. And for those of you listening, Katie is pointing to the inner flexure area of her elbows, which is a really common spot for eczema to present.
Exactly. Yes. And under the chin, in the neck folds, right? All these areas.
Behind the knees.
Yes, behind them. Exactly. So that's the number one reason for an eczema flare. Number two is actually weather changes, hot to dry, or hot to cold, cold to hot, dry to humid, etc. And then, yes, irritants and allergens can cause eczema to flare, but they're not the reason the baby has eczema. Eczema is a skin disorder, and then these things can make it worse or cause it to flare. But if it's a food that a parent is worried about, if the baby is, switched to milk formula and their eczema gets worse, then I am not concerned that they are going to have anaphylaxis, right? Or that severe systemic reaction because of a milk or from milk.
And systemic, sorry, just to define what systemic is. I know you said
systemic,
it earlier, but full body.
Having symptoms in other parts of their body, right? In different systems of their body. Their GI system, right? Their gut, their lungs, right? Their respiratory system, their skin, their cutaneous system. So all of these we call systems, but it's really just different parts of your body. And eczema is not concerning to me that they're going to have a severe reaction when they eat the food. Now, is eczema annoying and, uncomfortable? Absolutely. So the main thing to do is talk to your doctor about skincare maintenance and how to maintain eczema. Moisturize and use medicated creams if you need to, and soak and seal with bathing every day. And there's so many different things that I go through to educate. I'm sure you do as well, to teach parents how to keep eczema under control so that they can keep allergens in the diet. The number one thing is don't stop the allergens just because you see an eczema flare. If you need help, get some help, get some guidance, right? Have a plan, but don't stop, because it's actually could be harmful, right? You could be sent, again, if the baby's just had it once or twice and then you don't keep feeding it,
right,
you could sensitize them, right?
Right. You're losing that chance to make them tolerant to the food, where they're more increasing their chance to have worse allergies later on in life.
Exactly.
Right. Okay, so just to help for those that don't know, can you say what the most common food allergies are?
Sure, absolutely. So in babies, it's actually milk is the most common. Eggs is second most common. Peanuts is extremely common after that. So those are basically like the top 3 allergens in young children. When we talk about food allergens in general, we talk about the top 9. We used to have the top 8, and then recently sesame was added to the list. And so these are the top 9 food allergens or food allergy groups that cause about 90% of food allergic reactions in people. And so it's milk, egg, and peanut, as I mentioned, tree nuts, which
can you say what tree nuts are?
Yeah,
Everybody gets confused.
Specifically, a lot of people don't know that peanut is actually not a nut. It's a legume. It's in the same category as green peas and green beans and lentils, right? So those are legumes. And tree nuts are specific nuts like cashews and pistachio and walnut and pecan and, Brazil nut. Those are the tree nuts. And so they're different than, peanut is not in the same category. And so a lot of people sort of lump them together. So tree nuts are very common. And then we have wheat, soy, fish, finned fish, and shellfish, and sesame. And these are the top 9, most common food allergens. And in children, as I mentioned, milk and egg are the most common, but they're also the most likely to be outgrown. So probably about 80% of children with a milk allergy early on will outgrow it by their teen years. We used to think it happened earlier on, like more kids would outgrow earlier on, but we're seeing that it's actually happening later than we used to think.
Now, and I've read too that for kids that continue to have milk in their diets, they actually outgrow milk allergies sooner. Would you agree with that?
Depends what form. So if we're talking about baked milk or baked egg, then yes, we think that if a child who has a milk or egg allergy can tolerate a baked version, which means something that's in a flour matrix, right, like a muffin, baked in the oven at 350 or higher for about 30 minutes or more, if they can tolerate a food like that and they can keep it in their diet frequently, then that may help them outgrow that particular allergy faster. So the allergy,
that's great news.
Yeah, absolutely. So that's
hope is not lost. Yeah.
No, definitely not. So it's really important.
So you said milk and egg, there's about an 80% chance children will outgrow them. And specifically it's egg whites, right?
Yes.
Or is it egg?
The allergens are in the egg white. However, there are some allergens in yolk, and you can be allergic to yolk as well. And it's actually very difficult to separate, yolk from white. So
sure.
I never encourage parents to feed yolk in
that makes sense.
Egg allergic patient.
There's probably cross-contamination. That makes sense.
Exactly.
Okay, now what about nuts? Do you have any numbers in terms of how likely are they to outgrow nut allergies? And is there anything parents can do for that?
Yeah, it's less likely. Peanut and tree nuts is somewhere in the realm of about 15 to 25% of children outgrow. And generally speaking, if a child has a less severe reaction when they're first diagnosed, if their skin test or blood test numbers are smaller, then they're more likely to outgrow that. But generally, looking at the numbers, most children, when they're diagnosed with those allergies, will go on, into adulthood with the same allergies. The same is true for shellfish and fish.
Okay.
Mm-hmm. Wheat and soy are often outgrown. So if those are diagnosed early on, those are often outgrown as well. And I would put sesame in the tree nut peanut category.
Okay, so less likely to outgrow. I'm so excited because my nephew, as a side note, he can now tolerate a half a peanut. So we're all very excited.
So happy. So he's doing oral immunotherapy, which is much more common now than it used to be. And it's where an allergist will provide standardized dosing or standardized amounts of a food that a child is allergic to and have them eat the food every day. And every so often, maybe every few weeks, they will increase the amount in the office. The patient will continue that food at home until they get to a point where they're sort of desensitized, meaning the immune system doesn't react the same way. We're sort of tricking it, right, into thinking maybe it's not so allergic anymore. And, what this does is it gives parents confidence that if that child were to accidentally eat the food they're allergic to, that they would not have a severe reaction.
No, it's amazing. I'm so glad there's more research being done on this because I think it gives it's so nice for parents to have hope that once their child is diagnosed with a severe allergy, that there's a path towards improvement.
Absolutely. Absolutely. So it's so nice to be able to give parents options, and we do a lot of shared decision making. Some parents don't want to do that. I mean, it's a commitment, right?
Right.
Like
Definitely.
allergy shots, it's the same thing for environmental allergies, which we can talk about, but these things are commitments, and some people, for multiple reasons, can't do that, and they need to be educated on avoidance and all the
Might
things
just be
that go
easier
along.
just to avoid altogether.
Exactly.
For some families,
Right.
yes.
Yeah.
So can I now just to segue back from I know we've been talking about anaphylaxis and the big reactions. A lot of questions come up with mild allergy reactions. So I'm curious your take on this, or how parents should approach this. There's a number of kids that get, let's say, like a tingly lips or a tingle when they have a nut, for example. Or I'll have a lot of kids that have citrus or a food and they have what we call a perioral rash, or a rash around the mouth. Do you think with kids that have these more mild reactions, is there any reason why those children should not continue to eat those foods?
No, I consult on a lot of these patients, and there's two things. So there's perioral rashes or perioral hives. You can get, those bumps, you can get redness. So
Around the mouth.
Around the mouth, exactly. I keep forgetting that we're also on the radio and that people aren't seeing everything I'm doing. Yes, around the mouth. And so I always tell parents, if a food causes a rash wherever it touched, so even if it's like up on the cheek and the baby, like is eating with their hands and they get the food around their mouth or on their cheek, if they have redness or hives, wherever the food touched, but they ate the food and ingested it and did not have a rash anywhere else on their body, then continue eating the food. That is just the perioral rash that we're talking about. It is not harmful. It is not concerning that we're going to have a more severe reaction if we keep eating the food. Some parents get nervous when they see it, which is understandable. I mean, I have 2 kids. Anytime we see a rash or something, we get we get concerned. And so sometimes I'll say, you know what, just put Vaseline or Aquaphor on their face before you feed them. And they won't get irritated. Their skin won't get as irritated. It won't be as, scary for you to see. So that's a little tip. But
that's a great tip. So in other words, they can keep feeding that. Let's say strawberries cause the perioral or around the mouth rash. A lot of parents, their instinct is to not want to feed that food, but you're saying maybe prep the mouth, put some Vaseline around the mouth, and then continue to give the food.
Exactly.
And that's okay.
Yes. And strawberries are one of the most common, tomatoes and citrus. Now, when I counsel families, listen, if they want to remove strawberries and tomato, it's not the end of the world. It would be unlikely that baby would then develop a food allergy. Is it possible? Sure. There's 160 foods that have been reported to cause food allergy, and probably even more. So any food can cause a food allergy, but I worry most about those top 9 that we talked about.
Right.
So
Right.
egg, milk, right? So if any of those are causing that rash, keep going. Don't stop. Use
The likelihood it won't develop.
Exactly.
Won't
And if
develop
you're
too bad
concerned,
allergy.
talk to the doctor, but at least have some of this knowledge, in your tool belt that you can use when you have these reactions, so that hopefully it isn't as scary, and you can have a plan of what to do and how to feed baby.
Now, Katie, do you know when we were speaking about the oral immunotherapy to help parents lessen their children's food allergy, do you know where, are there any centers that you recommend, any places that you would recommend a parent, if they're listening and they have this in their family, where can they go?
Oh, sure. Well, there's multiple options. I think, you definitely want to speak to your allergist in your area, because there are some private allergists. There are actually quite a few all over the US. And there's a website that you can go to find an allergist near you who does oral immunotherapy. We have a center here that's close by that is, well known for doing oral immunotherapy, but there's academic centers that we have. There are two of our top children's hospitals here in Los Angeles also do oral immunotherapy. So I think,
I think it's so great because when I feel like there's been a lot more opportunity for this since in the last decade or so, where it was really hard to find a place where a child could get immunotherapy, and I feel like it's a burgeoning field, which is great.
Yeah, it really is. We're learning a lot more about food allergy. I think it's an exciting field to be in. Not that food allergy is exciting to diagnose. It's not. It's a hard thing to diagnose as an allergist on a daily basis. But I feel fulfilled because I can really educate families. And
there's options now.
Exactly.
Yeah. There's hope. There's options, which I think is what every parent wants.
Yes, we can try to prevent, and if we can't, then we have things we can do to manage.
Amazing.
Yeah.
All right. Anything else before I segue into environmental allergies? Anything else to add?
Goodness, I don't think so. We covered a lot. Yeah. Hopefully it was good. Hopefully it was helpful to everyone.
I think, as you said, all education is good and important, and you never know what family's listening that this is helping. So I'm sure it's helping.